We are back today with Barry Chalifoux, a mental health expert working in Western Canada, talking about the legalization of marijuana happening today across the country. Okay, so I have a friend, sounds like I'm talking about myself, but I'm not. I have a friend who has been treating, self-medicating, I guess in a sense, as we referred to in the first half, his depression and anxiety with marijuana. This is common, but studies are saying it doesn't necessarily help. What are they finding?
So they're finding that there's a lot of controversy and there's a lot of experts that are trying to push their own agenda on the use of marijuana and why people need it and why people don't need it. And so there's a lot of conflict out there, and you'll find a lot of scientists and researchers trying to push their own ideologies about marijuana use. However, when you look at the people on the ground, like the ones that we love, the people that we care about, my clients that I've had in the reserves and the different communities I've worked in, I look at them at a personal level and I see it's not just about the research, it's about what I see in front of me. And I see a lot of young people struggling with depression and anxiety, just like you have a friend there that's struggling, and the use of marijuana. And so we look at the research and it shows that you know, there's a lot of problems that can happen with young people who use it. We also look at how there's a lot of people that are using it to cover up with their depression, to kind of medicate what's going on. However, there's a lot of research out there that shows that it could lead to anxiety and lead to depression. And so why cover up something that's only going to bring it back and cause more problems moving forward, especially with the cost that it takes, you know, when you have, especially if you're on a low income budget and you're spending a lot of your money on medicating with marijuana rather than finding alternative methods.
I read too there's a link with schizophrenia as well, so there's a risk of increasing that if you have something in your family that you don't know about. So you think 1 in 10 can be addicted. It can increase your anxiety or your depression. It can also have cause other mental health problems to occur. It's kind of scary.
Yes. In fact, with the link of schizophrenia, it's something that is actually quite accepted out there amongst many scientists. So that's one of the ones that really can show the correlation, although it doesn't necessarily cause causation because there's still research that needs to be done, but it does link that way and it's starting to point in that direction and people see that. And I know the government's really trying to put something in place with the different provincial authorities to legislate on young people not using marijuana because their brain is still developing. But as we both know, not a lot of young people obey the law these days.
It's a big social experiment, kind of scary. Thinking about parents out there, how do they have that conversation right now with their child about this legalization?
So I have 2 nieces that I've adopted, and I also have a young relative that's staying with us right now, getting through school. And so it's a hot topic for me in my household because I'm concerned and I know what marijuana is like and I've grown up around it. But let me just start with the story here. When I was younger, just a young boy, we went to a home that my family really loved, and this man had grown his own marijuana plants. And so when he had done this, we didn't really know what it was. I didn't know what it was. I just thought, oh, this is kind of neat, right? So we were over there, we're watching the Oilers hockey game, and we're excited, we're having a great time, the nicest guy you ever met. And then I come along and I touch his marijuana plant. In that moment, just in that very moment, his whole attitude, everything about him, his persona just changed instantly, became the darkest, scariest monster I ever knew just for touching his marijuana plant. Now, when you look at the DSM-5, which mental health specialists use to diagnose mental disorders, you will see that marijuana use disorder, one of the characteristics is putting other things behind marijuana use. So for example, putting family behind it and putting marijuana use ahead, and seeing that personal relationships actually don't matter to you anymore. And so with that being said, like, parents need to be able to explain to their children what the effects are, what it does to you, because it scared me. As a child, it scared me to know that this man could change in a moment because of his marijuana use. And I'm scared that parents don't talk enough about it, they don't research about it, they only want to keep their mouths tight-lipped, especially in our Christian community, because they don't see their kids doing it, but you just never know. Your teenager might be doing it around the corner. That's what happened to me, and it definitely sparked a large debate afterwards.
I think talking to teenagers and children about it, because it starts so young nowadays and it's offered so young. We only have 30 seconds left, but for someone watching this, maybe they have been medicating with marijuana or some other substance, alcohol, drugs. because they don't know how to deal with the pain that they have. You've gone through some trauma in your childhood. You even tried to take your own life as a kid. What advice would you give them about how to face this or how to stop this?
Yes. So I would say stop listening to everybody around you that's really pushing marijuana use and how it makes you feel. Just take a moment to look at what your life was before marijuana. What was it like? Where was it going? And try to see that there's other people that are going through what you're going through and finding healthier ways that's not putting or injecting anything into your body, not inhaling anything, and it is coming out with a positive, healthy outcome. And of course, with the aspect of our faith, knowing that God has created you for something special, and He's going to provide the people to help you and the resources to help you if you ask Him and you follow Him.
There's so much more we can talk about, but we are out of time. Thank you so much, Barry Chalifoux, for coming today to help us start to navigate this new reality in Canada.
And you're welcome, and thank you as well.
If you're relating to any part of this, if you're going through a hard time, if you've been using marijuana as opposed to getting the help that you need, I tell you, talking to somebody is the first step. Getting help is the first step. If you just want someone to pray with you or help you negotiate what those first steps might be, we would love, love, love to pray with you. That number is on the bottom of your screen. We'll be right back.